testing.
Hello and welcome to another Facebook Live here in Berrien County. I'm Jillian Conrad. I am with the Berrien County Health Department, and I'm joined here by Nikki Britton, who is our health officer here at the health department. Thanks so much for joining us. We are doing these weekly updates. This week, it's just an update from the health department, and we are ready to dive in a little bit more as to many of our processes and the details of things that have been going on with our health department. So let's just dig in right away, Nikki. As we always do, I think it's important for us to just start with kind of what are the numbers showing us? What are the rates of COVID-19 here? How's it looking here in Berrien County?
Yeah, it's continuing to look really encouraging. We are seeing a stable rate of cases. A week or two ago, we were seeing or 2 to 3 weeks ago, we were seeing a little bit of an incline, and those inclines always make you wonder what's coming next. Fortunately, it just came right back down. And so it seems like it's just another bit of variation, which is expected as we're monitoring this infectious disease. So we're right around 40 cases per day on average, and that is a good place for us to be right now. If the numbers go down, we'll continue to be grateful for that, but we can really maintain where we're at. Our percent positivity has dipped down to about 7%, which is fantastic. We're encouraged by it continuing to decline. Our testing levels remain pretty consistent, and that we're still seeing testing. So just want to put out there, I mean, if you're experiencing symptoms or you think that you might have COVID-19, there are still plenty of testing locations. You can find a list of all the testing locations in the county on the health department's website. Some you don't even need a doctor's orders for, you could just go. So check that out if you're feeling under the weather and think you might need a COVID test. But things are looking pretty good. And one of the most encouraging signs, as we all know, one of our main goals in response is that we don't want to overwhelm the health system. And we want to make sure that we have enough healthcare resources in our community to care for everyone, whether you have COVID, whether you're experiencing a heart attack or some other chronic condition, whatever your health needs are, we want to make sure our healthcare system is able to do that. And hospitalizations with COVID-19 are also really declining. We've seen more of a decline in the last 10 days than we had really seen before. Those numbers had been flattening. So we're really, really encouraged. This is definitely has its roots in these good news. Falling over my words today. It's been a long week. But this good news in the data can definitely be attributed to the actions of our community and continuing to be diligent in our social distancing, in wearing the mask, washing the hands. I'm sure you are all sick of hearing me say these same things, but they do work. These are our tried and true methods. To sustain some of these downward and stable trends, we need to continue to be diligent.
Yeah, absolutely. Well, that is good news that we're in a favorable place here in Berrien County at this time. So now we've heard a few reports, especially this last week, about new variants of COVID-19, mutations of the virus. Sounds kind of scary. What do we know about these?
So with the variant strains that are out there, what we predominantly are learning is that some of the variants are more transmissible. That means that they are more likely to, if somebody with a variant strain, infected with a variant strain, might be more likely to spread it than some of what we were seeing for much of 2020 in this country. So there's not really evidence that it causes more severe illness, but we also know that the more people that have COVID-19, the number of people with a severe case of it is going to increase. I mean, it's 0.5% on 1,000 people versus 0.5% on 10,000 people. The rate and risk remains relatively the same, but when you're talking about larger numbers, there's more likely for that. So that's another reason why it's important for us to continue to be diligent in those, all of those practices, all of the social distancing, hand washing, wearing a mask, avoiding close contact. That will prevent transmission and slow transmission of this variant strain as well. The other thing that people are very concerned about with the variant strain is the vaccine and vaccine effectiveness against these variant strains. For the most part, we're not seeing a lot of evidence that the particular part of the virus that is targeted by the vaccine, that's not mutating in a way that would render the vaccines ineffective for the most part, but the scientific community is watching that. And the way that this vaccine was developed, it is possible and to fairly quickly change course, alter the vaccine so that if that protein that's being targeted changes, we can change the vaccine so it matches it once again. So there is definitely reason for the scientific and medical community to be watching this and continuing to test for the variant strain, watch what's going on, but it's not at all time to panic. We've got lots and lots of tools in our tool belt, and all of the things that we are doing right now will continue to protect us individually and as a community.
So, and we know that viruses mutate. This is just what viruses do. We see this with flu viruses, and that leads us to have a sort of different cocktail in each year's flu vaccine. Do you think that we would get to that point with COVID-19 and needing an annual vaccine?
I mean, it's hard to say. It's possible. Some of it just depends on how much cross immunity there is for the different variants and how different the mutations are. With the influenza virus, the proteins on the outside of the virus are just very different between strains. And these variants of the novel coronavirus, of the COVID-19 virus, may not be as different. We need just more time to tell.
Yeah. Well, let's talk more about vaccines. You know, we keep hearing over and over again here at the state level, nationwide, there is not enough supply to meet the demand. Tell us more about what all of that is meaning. You know, how much are we getting each week? What is that looking like here locally?
Yeah, so these are really good questions. A lot of it is not within our control locally or even our full purview locally. So we do know that the manufacturers of the two vaccines that are out there, Pfizer and Moderna, they are working to continue to manufacture virus, and there's a set, or vaccine, not manufacture virus, manufacture vaccine. And there's an amount that they're able to produce each week. We're hearing that there should be some increases in the next couple of weeks in that production to the tune of maybe 10, 15% more vaccine is just available in our country. So as more vaccine is available, each state that gets an allocation from the federal government, that allocation to each state is larger. And then as each state has a larger quantity of vaccine, they can then distribute larger amounts to their local health departments and hospital systems so that we can have more vaccine on the ground locally. So there's a lot of things that can impact this, and having more providers come online to provide the vaccine, that doesn't necessarily make more vaccine available. And so we really have one slice of pie. There's a set amount of vaccine, and we could divide that in many different ways to many different providers. That's why there's a little bit of a slow onboard of primary care providers. They're getting ready to be able to distribute the vaccine, but they're not distributing it yet because we want to make sure that everybody who is providing vaccine can do a meaningful amount. So we're hearing that there will be more vaccine coming to us here in Berrien County as the local health department and to the healthcare system, at least over the next few weeks. Some of this will also change. It will change probably pretty dramatically if and when the next vaccine comes to market. We should be seeing some data from the Johnson & Johnson vaccine very soon. That could go through an emergency use authorization process in February, perhaps. Maybe it'll be in March, we're not sure. But the supply is ramping up as quickly as it can be manufactured. And locally, we are committed to administering the doses, 90% of the doses within 7 days. And over the last couple of weeks, we've been hitting that goal. Everything that's coming to us, we are getting out to people right away.
Wow, that's really impressive. So for those of us and people who might be watching either us live now or the replay, who are just still a little bit fuzzy on what the process is for saying, I would like a vaccine, what do people need to do? What are the steps they need to follow to kind of get in line to get a vaccine at this time?
Yeah, so that's a good question. And the thing that I think is adding to a little bit of frustration from people is everybody has a slightly different process for what that looks like. So that can be confusing. So in Berrien County right now, for the health department, for people who are eligible, if you are an adult 65 years of age or older and you live in Berrien County, you can sign up on our wait list. And I know many of you have. We have around 20,000 people on that wait list who have indicated, yes, I would like the vaccine. So we have that list. We have your phone number and your email address that you provided to us, one or both of those. And so we've got you on our list. We're planning for you. We're working as soon as we get a vaccine in. We are opening up clinic appointments and we're moving through that wait list. There is a bit of a prioritization according to the ACIP guidelines that 75 plus are at a higher risk because the data shows there's higher risk of hospitalization and death amongst those 75 plus compared to those 65 to 74. So we have done a bit of a prioritization of really trying to target our older adults first before going really significantly at just 65 plus. So you're on the wait list, we're moving through it. As we learn of vaccine, the health department opens up appointments for clinics that have already been planned. We plan our clinics weeks out. The last piece that comes into that planning is appointments, number of appointments available, and then getting people into them. We are committed to not having an appointment for you unless we have a vaccine for you. So if you have an appointment, we have a vaccine for you. So when you get a notification that you can register for an appointment, it's really important to, you might have to move quickly. You might only have a day or two to think about it. We're trying to move towards being able to give you a few more days time, but we need people to be ready. We need you to check your email every day if you're on our wait list. It still might take a few weeks. So you sign up on our wait list. The second step really is the wait part of the list. We have been getting approximately 1,000, maybe 1,500 doses of vaccine into our health department, of first doses into our health department each week. And as I said before, we had a total of 20,000 people sign up on our wait list. We've made it through about 3,000 people on that wait list, and we're hoping to make even faster progress as the weeks wear on. But there's only so much vaccine, and we would love to put all of you at the front of the list. We'd love to have all 20,000 of you come one day, and we just get you covered. We want that for you, but we need you to continue to be patient as we move through this. And then when we have vaccine available and we get to your spot on the wait list, we're going to send an email, which is why we want you to check your email daily. There will be a link to register online. For those of you who have called and you do not have an email, we also have recruited some volunteers, and we have some help from some partner organizations that we're making phone calls to you so that you can also get an appointment. So we're trying to really work through this in a couple of ways and make sure internet is not the limiting factor in somebody being able to get an appointment. Just because you get an email link, I will say it is first come, first serve. And our biggest priority is we have to make sure those clinics are full. So it's possible you may click on the link and all the appointment slots will have been taken by that time. So that's why we're really encouraging you to stay watching your email. If you're not able to get an appointment, we don't remove you from our wait list. So you will have an opportunity again. Just continue to watch your email for that.
That's really good to know. And what about if the health department is really prioritizing adults over the age of 75, what if they have a partner, a spouse, a caregiver, someone in their life that's not quite 75, but over 65? Could they bring them along with?
So we're really making efforts to try to make sure we can accommodate things and do things as efficiently as possible. We know that sometimes, especially in this age group we're targeting, that transportation and driving and having people to help get out of the house, that is sometimes a consideration. So if there is a spouse or a caregiver or a friend that is driving somebody 75 plus to their vaccine appointment, if that person assisting them and coming with them is 65 plus, we definitely want to vaccinate them as well, but we need them to have an appointment as well.
So appointments for each person.
Exactly, because we need to make sure we can match a vaccine to an appointment to make sure our supply, because we don't want somebody that shows up in the morning to take the vaccine of somebody in the afternoon who has an appointment, because we're committed to making sure we have a vaccine for every appointment scheduled. So being able to plan for that is important. So if you get a registration link and you have your spouse, for example, there can be 2 appointments, one for you and one for your spouse or for your caregiver who is also eligible. This does not apply to spouses or caregivers under the age of 65. We are only vaccinating people who are currently eligible for the vaccine. And even though we're targeting 75 plus, it's that 65 plus eligibility.
Gotcha. So, we've heard from a lot of folks recently who said they've signed up on the wait list several weeks ago. They still haven't heard anything. They haven't gotten an appointment yet, but it sounds like the bottom line is this is a numbers game. There's only one sliver of pie that's being given to Berrien County. So patience definitely seems to be the message right now, is as we continue to work through things as quickly as we can, just got to hang in there, right?
Yes, and I realize that becomes harder and harder when you see the light at the end of the tunnel. You really want to get to the end of the tunnel, and it does make it harder to be patient. We've been being patient and diligent since last March. It's been almost a year, and definitely understand that's hard, and this is a scary time for a lot of people who are very concerned about their COVID risk. Again, we want to vaccinate you. We are working as orderly and efficiently as we can to get through our list to make sure that we are getting vaccine in the right arms at the right time. Your patience is so appreciated and needed to help make that happen. And so when you do come, you are also going to have a really great, smooth experience in our clinics. I'll also note that the health department, we're not the only ones that have a list. People can sign up through MyChart if they have a MyChart account with Spectrum Health Lakeland. The Benton Harbor Meyer is also administering vaccines, and that is through a special pilot program with the state. So our county is actually fairly lucky that we have a Meyer pharmacy. There's only 4 counties in the state that have that. So you can also get on a wait list with Meyer. We have no problem with people being on multiple wait lists. What we want to make sure people pay attention to is once you have an appointment, you have a specific day and time that you were scheduled to get a vaccine, it is important to not have multiple appointments. We don't want you to have an appointment with Meyer and the health department, or with Lakeland and the health department, or anything like that, because we're reserving a vaccine for every appointment. So if you don't need it because you already have another appointment or you've already been vaccinated, we want to make sure we can get that vaccine to another person. So if you somehow end up with 2 appointments, be sure to cancel. If you're offered an appointment and you already have one, keep the one you already have. All of that will make planning easier and help everybody get what they need. Because again, just like we've all been in this together with our diligence and our preventive practices, we all have to be looking out for each other as we're working towards getting through this vaccine process.
Yeah, we definitely want to maximize the use of this scarce and precious resource at this time.
Mm.
So we've talked a lot about what people who are over the age of 65 or over the age of 75 can do to indicate their interest in receiving a vaccine, either through us, through Spectrum Health Lakeland, Meyer, potentially other pharmacies as they come online. But we know that there's other people who are eligible to receive vaccines right now. How are we doing that? Working through employers? Tell us more about the other people, the other frontline essential workers who might be eligible.
Yeah, thank you, Jillian. And I mean, as most of us have been hearing, and as you all are probably aware, healthcare workers do remain eligible. They were in that first priority group, the priority group 1A. And there are some essential workers that are eligible right now per the state guidelines, regardless of age. It's based on profession. So we have made it through a lot of our healthcare workers, but we know we haven't made it through all of them. And there were some healthcare workers that 4 weeks ago may have said, I don't know if I want the vaccine, that are now saying, yes, I do want the vaccine. So we definitely encourage our healthcare workers, if you're out there and you still have not been vaccinated, we do have a form on our website. It says specifically that's for healthcare workers, priority 1A. You can fill out that form, and that will also put you in the queue to be receiving notification of how to register for an appointment. It continues to be important that we protect our healthcare system. So we want to make sure healthcare workers are covered. At the same time, it does become harder and the waits are becoming longer for healthcare workers as getting the vaccine is delayed, because there are other people that also have access to the vaccine as well. So if you're a 1B employer, we are also wanting to receive information. We don't necessarily need employees of 1B workplaces to contact us, but we're trying to work with employers to plan through how many employees they have. Some 1B workers are eligible in the state of Michigan right now. Not all of them are. So some of it we're holding for future planning when we're able to get to them over the next several weeks. Others we're working through right now. I know school staff, because pre-K through 12th grade, as well as childcare, all of the staff that have routine contact with students due to their role are eligible in the state of Michigan. In Berrien County, we're getting ready to start that process. We haven't been able to get there just yet. We do expect that the week after next is when we're going to be able to get to those educators. We are working very closely with all the schools in Berrien County, public and private, to make the arrangements so that teachers can have a very smooth and seamless experience with getting the vaccine, and that it causes as minimal disruption to students as possible and to school operations as possible. So anybody that works in one of those settings should be receiving communication from your school leadership, and we're working to get those things planned. We are so grateful for all of the things that education staff and childcare staff have done throughout the course of the pandemic to meet the needs of our students during the end of last school year when school was not in session, all through the summer providing support, and then also all of this school year. It's been a tremendous job. We are really excited to be able to start educating or vaccinating that group of really important essential workers. And that is coming very soon with this increase that we hear is coming in vaccine. That should really help get that strongly underway in the next couple of weeks.
Well, that's really good news for a lot of people, I'm sure. So shifting gears just before we wrap up today, we know that there have been some epidemic orders that were issued last week indicating that restaurants could start to operate again in person for in-person dining starting on Monday, the 1st of February. So just walk us through some of those fast facts on what we can expect with that new change.
Yes, so indoor dining is something that is available and an option that restaurants can implement in their business starting Monday. And so I think that is a very exciting time for the food and hospitality industry. I think there's a lot of restaurants that are very eager to open. We also recognize that under the guidelines by the state, being at 25% capacity, some of our favorite places might not be able to open because being at 25% capacity, there's some calculations business owners need to do of, is it better to just do all takeout at that capacity? So definitely check and see if your favorite restaurant is doing indoor dining or doing takeout. Please continue to support our restaurants in whatever capacity. We know small businesses are just really important in a community. We want to make sure that they come out on the other side of this. Some of the other things, if you go to a place with indoor dining, some of the other things to expect in addition to 25% capacity, there is going to be social distancing with at least 6 feet between tables. There will be no more than 6 people allowed at a table. Everyone will be required to wear a mask except for when actually eating and drinking. And there's also a 10 p.m. curfew. So that means that all indoor dining buildings or outdoor tents that have more than 2 adjacent walls. And there's a lot of clarification on the MDHHS website if you want to see the exact rules, but the buildings must be closed at 10 a.m. So that doesn't mean you can come in necessarily and be seated at 9:45. The facility is expected to be closed with people exiting the building by 10 p.m. So outdoor dining can continue into the night. So it's really important that we understand these rules, continue to support our businesses, and do everything we can to continue to maintain social distancing and masking and good hand hygiene and all of those things, while also still having this part of our economy come back online.
Yeah, well, that's great. And it's good to know we can always still support our local restaurants by getting takeout, carry out, and eating at home with our family, as that still remains the safest option at this time. Well, Nikki, thank you so much. This has been really wonderful. We've gotten a lot of great information and updates about what's happening here at the Berrien County Health Department. Thanks so much to everybody for tuning in. Just as a reminder, where you can find a lot more information about everything we've talked about here today. Our website, it's www.bchdmi.org/COVID-19. That will take you to our info hub, all things COVID-19, including a lot of the vaccine information. You can sign up for a community newsletter that has been very geared towards COVID-19 vaccination. That's going out weekly, and you can get those updates sent straight to your email inbox if you choose. You can also find all of those forms, the sign up, the pre-registration wait lists, links that we talked about earlier. Obviously, if you're here on Facebook, thanks for following us. We encourage you to share this video as well as other posts that the health department does. And then lastly, if you just want to pick up the phone and talk to us, we're still operating our hotline. It's 1-800-815-5485. You can reach us, talk to a real live person Monday through Friday during business hours. Thanks so much for joining us again today. This has been the Berrien County Health Department's COVID-19 update, and we'll see you again next week.
Thank you.